Hey folks, Dr. Erik here to talk about an interesting subject that has recently made the news again. To talk about the relationship between opioid addiction for musculoskeletal, that begins with musculoskeletal care in many cases, and how they relate to each other. Yesterday, Purdue Pharma, the creators of OxyContin, have recently agreed to plead guilty for kind of misrepresenting what OxyContin could do in regards to pain management and how it related to people's health. They've agreed to plead guilty. They've agreed to an $8 billion fine, and they've agreed to close down the company, which is a very substantial maneuver. Now, the family, it's a family-owned business. Whether there is any punishment that relates to the family, frankly, I'll be doubtful. But at the very least, hopefully that $8 billion can go towards helping to rectify some of the horrifying addiction that has come from OxyContin. Now, I know that there's some people who are going to say, well, people need advanced pain relief, and that is very true. I have worked inside the public health system with helping to oversee how hospitals and clinics work throughout New Brunswick, and I'm very aware of the need for advanced pain medication. The problem that arose with OxyContin, I'll just give you a 40,000-foot view of the Coles notes, if you will, was when this was pushed out back in the 70s and 80s, there was internal research by Purdue Pharma that said that there was a risk of addiction with this medication. However, going out to produce, helping to sell to family physicians through pharmaceutical reps and so on, they swore up and down that there was no such research, that this was a very, very safe medication, and that it didn't stay in the system to produce a physiological addiction. And of course, people thought it was great. They thought, wow, I'm really happy to be able to help people with their pain. And so this was prescribed at a very high level, and it took quite a long time to realize that this wasn't quite the case. And so, of course, legal matters ensued, and it really took decades to frankly get to this point. We now know that this is an issue, and we now know that it's going to be a lot easier to try to treat the problems that people have versus treating potential addiction down the road. Now, here is one of the greatest shocking statistics that most people don't realize, and that is that very close to 50% of all non-cancer opioid prescriptions is for low back pain. So let that sink in. A condition that most people think is fairly benign, that most people get over, is actually half the cost or half the cause of opioid prescriptions in the beginning of addiction. And, there are some very rare circumstances where this is appropriate, but as we're now realizing in the courts, that we now see that this is very inappropriate. I've written an article about this and about how it relates to musculoskeletal pain, how it relates to low back pain, and the crux of our thoughts on this whole process that all my physio colleagues, chiro medical colleagues agree with, is that the problem is we do not treat musculoskeletal pain, especially low back pain, properly. Even how common it is, 80% of everyone at some point is going to have low back pain. Luckily, most people get over it very easily through some exercises. Sometimes they see people like myself, they see physios, they see whoever they trust, and they get over it. But a lot of people don't. Car accidents, stress-related injuries, things like that. These are all things where they need more and more help. Chronic pain is a very, very severe problem, and it's really almost a silent killer because it will result in a lot of different comorbidities, increased blood pressure, mental health declines, you name it, and all those peri-health issues that start to stack on top and eventually become very insurmountable. So we need to treat low back pain better. We need to treat musculoskeletal pain better. And that's by following the evidence That's by using multimodal approaches and getting to the cause of the problem. Looking at biomechanics, looking at ergonomics, giving them the right exercises. I'm not talking a sheet of exercise that you pull from your drawer that was produced in the 1970s. I'm talking about exercise tailored to the person, making corrections, making sure certain muscles that are overworking, turn them down. Other muscles that are not working, turn them up. Get those joints moving appropriately. These are all the things that we do to help you live your most optimal life possible. And if everyone were to do this, if we were able to put the resources together in order to treat back pain and musculoskeletal pain properly, we frankly, literally would not have this opioid epidemic that we're in now. But here we are, so let's start doing this right now. Read my article, and if you have chronic pain or you have chronic low back pain, please give us a call. One of our clinics, we would be happily to provide a personalized rehabilitation plan together for you to get you on the road to recovery. Thanks a lot.